Grandma. Today is our immunology lesson. We'll start with the innate immunity. Innate immunity is one branch of our immune system. It is born with us and it will start working from the very first moment of our life. It is the first shield that protects us from any invading microorganism and it consists of the physical barrier, which include the skin and the mucous membrane that line our hollow organs like the lungs, bronchial tree, stomach, genital, and urinary tracts. These physical barriers are boosted with a number of chemical substances. These chemical substances, also referred to as our chemical barriers, play a role in attacking these microorganisms that try to evade our physical barriers. Examples of these chemical substances are beta-differentiins, lysozymes, and catalysidines. It is important to mention the role of lactoferrin and transferrin in binding to iron and preventing its use by the microorganisms. These microorganisms are not able to grow without iron, so it's a very important process. Other components of innate immunity include cells and specialized circulating proteins called complement. One of these cells are the neutrophils. So what's the neutrophils? Neutrophils are the most common type of white blood cells and it makes up around 70% of the white BC population. It has a multi-segmented or multilobulated nucleus and it's stained neutral to hematoxylin and eosine stain. That's how it gets its name, neutrophils, or the polymorphonuclear lymphocytes. Just like monocytes, they are formed in the bone marrow, they circulate in the blood, and they travel to tissues or organs in response to an injury or an assault. Neutrophils have a longer lifespan than monocytes. They can survive up to 5 days, while monocytes will pass away in 1 or 2 days if they have nothing to do. Macrophages has the longest among these cells. It can survive for months or even years after they have been formed. Now let's assume there has been an injury in somewhere in our body, with the subsequent release of chemokines or chemoattractants. These circulating neutrophils will slow down and start a rolling movement on the endothelium, which is the lining of the blood vessels. This rolling or sliding movement will expose these neutrophils to a higher concentration of chemokines and will expose them to a number of activating factors expressed by these activated endothelial cells. This will initiate the process of activation of the neutrophils and their passage through the endothelial cells and toward the injured tissue. A number of factors that activate neutrophils include the lipopolysaccharide tumor necrosis factor, interferon gamma, interleukin 8, complement C3A and C5A factors, platelet activating factor. Once these neutrophils being activated, it will start attacking microorganisms 3 different ways: phagocytosis, which is the process of eating or ingesting these microorganisms; degranulation, which is a process of chemical killing of these microorganisms through chemicals formed and stored in vesicles inside the neutrophils; and lastly by NET, which is referred to neutrophil extracellular traps, which kills microorganisms outside the cells. I hope you enjoyed this immunology lesson. I will see you soon, Grandma. Bye.